We have a challenge in that we have a sick population of patients. They have a lot of chronic illness. Their health status is not particularly strong. Our healthcare system is complex, and our ability to continue funding what we're doing is challenged by the inability to keep raising tax revenue, insurance premiums, or copays. So because of all that, we've gone to a different way of designing how the healthcare system will work in the future. Next slide. So, and we are recording, correct? Okay. So what we have now is to start rewarding folks on episode-based care for outcomes to get away from paying for just services, paying for complications, readmissions, but rather to incentivize more efficient and effective care where the more effective providers will earn their fee for service, but will also get bonus payments for helping us run a more effective healthcare system. So on the top of the slide, you see under the objectives, we want to improve it's almost based on the triple aim of Berwick, improve the health of the population, improve the experience of care, empower patients to be more engaged, and to also reduce total cost of care. So we will try to improve the experience for patients, their outcomes, and also provide incentives for providers to work together and to change their daily operating procedures. Care is delivered through medical homes and health homes. During 2013, we're going to be moving to an incentivized health home environment. While at the same time, for more acute services, we'll be doing an episode-based approach. So we have new episodes being developed for colonoscopy, cholecystectomy, and tonsillectomy to join the current new episodes, one of which is URI, ADHD, hip surgery, CHF, and ADHD. And the four broad aspects of the program, results-based payment and reporting, improving the workforce of our state to deal with expanded access to care if we expand Medicaid and others, have greater integration of health information technology into practices, and again, continue expansion of access to reduce the population of uninsured patients. Let's go to the next slide. This is a partnership across amongst the payers in the state, Medicaid, Qual Choice, and Blue Cross. Medicare nationally is a supporter. We are a highly regarded applicant for their innovative services. We may get a very large grant very shortly to continue the expansion of our episodes. We're also getting other support from Medicare, from CMS, in terms of waivers and administrative simplicity to help us do expansion of innovative ways of paying for care in the state. I think all of this helps to create an innovative, critical mass to encourage practices such as yourselves to see that a large amount of your business is doing a different way of paying for care that will then incentivize innovation and entrepreneurial activity at your end, because it affects more of your practice and more of your business to help benefit from innovations that will increase your economic incentives and affect more of your patients you see on a daily basis. Let's do the next slide. We've been working with providers throughout the state. We've been having workshops. We're getting outreach to have participants help us shape our design of our system. We've just had new work groups. We've had expert clinicians in private practice as well as at the academic centers design new episodes. We've done many months of research, data crunching with our consultants such as McKinsey, and getting feedback from folks such as yourselves on phone calls, webinars, and in-person workshops to try to make this work. We want the program we're putting together to be fair, be effective, make sense, and also to incentivize you to make change in your daily practice. So we've also been working with your associations as well as individual practices. So on the next slide, what we're trying to do is promote coordinated team-based care, both at the health home level, the medical home level, and to have providers break down their silos so that a principal accountable provider, or the quarterback, is accountable for the total cost of care, but then work with others involved with care who are more passive players, such as ER docs, hospitals, radiologists, pathologists, and others, to create a more holistic approach to care, to manage the total cost of care, and to then result in better outcomes for patients with more efficient care from a cost standpoint, as well as from a better outcome standpoint.